I ended up being one of the first people in the state of Virginia to be a Psych NP, with the certification. So then I came back to Shenandoah and I said, we need Psych NPs in Winchester, we need Psych NPs in the area. We need to develop a Psych NP program. You can come to Shenandoah with a bachelor's degree and a 3.0 grade point average, bachelor's degree in nursing. And you can end up in 2 years with a Master of Science in Nursing and then also a Psych NP. So in 2 years, you can get all of the courses that you need as a Psych NP for the certification exam. And then the other thing that we've really seen is in our country right now, we don't have enough psychiatrists, we don't have enough people doing mental health. So a lot of the family nurse practitioners would say, we're spending a lot of our time with people who have mental health problems, but we need the knowledge base and the information. And then also we developed at Shenandoah a DNP program, and the student could either focus in psych or they could focus in FNP. So we've admitted students in that way too. They finish up a DNP and then they also have the psych specialty or the FNP specialty. So we developed the platform that we're really using right now, and that we've really just started in the last year, is students can come to campus live. We're going to have, every Thursday is the day that we do the Psych NP classes. And so they can come to class live or they can Zoom in. So we have students who will be in the little pictures, the little boxes as far as Zoom, and then we'll have some that will be live. So that we've got contact with them every week. They have the continual information every week. And in terms of everybody coming to school live, we do that maybe once or twice a semester at the most. And so it tends to be, I think, more cost effective for them, a little bit easier for their schedule, and they have a continual flow of content where they're engaging with us every semester. I see the future of this program as continuing to have individuals who have a bachelor's degree who want to be a psychiatric nurse practitioner. I see the future of the program with individuals who perhaps chose another specialty, such as family nurse practitioner, geriatric nurse practitioner, but really want to have that piece of psychiatry, because more and more what I hear, we feel good in whatever our specialty is, but we really need that mental health knowledge. We need the neuroscience, we need the psychopharmacology, we need the therapies. Because in our program we really combine the psychopharmacology piece, but also the therapies. There are a lot of individuals that need a lot more than medicine, and sometimes the medicine's not what they need. So we really try to prepare that practitioner who can work any place with any population, in the hospital or out of the hospital, but that also combine medication with psychotherapies. And I see that continuing, but we want to make sure that the quality is good. We want to make sure that we graduate somebody who has the knowledge and skills, who can do what they need to do, and not just read the stuff in the book. But so we make sure that for our program they have 600 clinical hours. And we make sure that those clinical hours are with children, with aging adults, with young adults, so that we're really looking at that. So I see the potential for the program to grow.